Good morning, Sudha. Today is November 18th, 2020. Please confirm for the record that you are aware that this is being recorded and that you are giving your permission to do the interview.
Hi, Crystal. Yes, today I have given permission to record this as a video interview. And what else did you ask me to confirm?
That you're aware that it's being recorded.
I'm absolutely aware of that.
Okay. Would you please give your name in full?
My full name is Sudha Subramanyam.
And what is your present title?
I'm a physician. I'm a resident physician at the Family Medicine Residency of Idaho. I'm a second year chief resident.
And where did you go to medical school?
I went to medical school at in Bangalore, India, and my university was called Rajiv Gandhi University of Health Sciences, and my medical school was Adi Chanchandgiri Institute of Medical Sciences.
And you're currently a resident. Where are you completing your residency?
At the Family Medicine Residency of Idaho, Nampa Program.
Gotcha. Can you speak about your current position and what you do on a daily basis?
Yes, so I am a second year resident, and my daily work kind of changes every 4 weeks. So I do a lot of inpatient work where I admit and manage patients in the medicine floor, in ICU, in med surg, and telemetry floors. I also do a lot of OB where I deliver babies and take care of postpartum moms. Um, and we also do clinic in the outpatient setting. So I have my own primary care panel, and I also do respiratory clinics, which is part of the COVID clinics right now. So those are some of the things that I do. I also sometimes go out and work in specialty clinics with other specialists in the Treasure Valley, and um, I also do some community work, like community projects and stuff. So these are all just the different things I do.
So you sound quite busy.
Yes, it is pretty busy overall. Yeah, we spend at least 80 hours at work every week, so it is pretty busy for sure.
So could you tell me a little bit about the types of patients you treat in your programs, who they are, and kind of what their backgrounds are?
Yes, so our program is very uniquely located in a spot where there has never been healthcare access in the past. And our hospital opened in the last 5 years, like about 5 years ago was when our hospital opened up. And then our residency program started about 2 years ago. So we are a federally qualified health center, which means we are able to provide care to a lot of low income population at a very low cost. We are able to provide them through a sliding fee cost. Um, so I would say a bulk of the population is kind of a rural and a suburban population. And about 25% of our population is from the Latino background. We do have a large portion of our clinic patients are all from the underserved and also a very economically, from people from a low economic background. Um, so I would describe that as a type of patient population. We do have a lot of agricultural patients and a lot of people who work in the local, you know, um, small mining industries and agricultural industries. That constitutes a big part of our patient population.
Gotcha. So what unique challenges do you and your program face with COVID-19, and what are the barriers and obstacles that you've come across?
Yeah, so some of the unique challenges that we have faced, I would say, with the COVID-19 is that a lot of our patients um, believe that the hospital is an infectious place, and our clinic is located within the hospital right now. So I think we, as a primary care provider, we are unable to provide long-term care to some of our patients because they are just not able to come to the hospital because of all these fears around it. And it is a very fair fear because our hospital does have a lot of COVID patients, And I totally understand, how this fear could come on. Um, and I would say, so, being able to cater to our patients has been a challenge. So in a way, I think we could be contributing to the morbidity and mortality of our patients because we're not able to do the regular weekly or monthly appointments. Um, Another obstacle as a residency program or a teaching program, the one thing that we have noticed is that some of our outpatient providers, like outpatient specialists, are unable to take um, learners at this moment or unable to take residents at this moment because they want to reduce the number of people in their clinic. And also, some of the clinics are also running a little bit low with their clinic numbers. So, so we are having some of those challenges from a residency perspective. Um, Also, I would say the number of inpatient um, experience that we're getting has gone up significantly in terms of just ICU management and care. Um, I feel like we are spending a lot of time in the hospital, sometimes a little bit above and beyond the time that we're supposed to work, simply because we are having to provide care to some uh, really unstable, medically unstable patients, especially from COVID-19. And it is taking up a lot of time for us to just sanitize our PPE. So that kind of adds more time to our work overall.
Um, how do you see COVID-19 impacting the learning of students and residents in family medicine, and what changes do you think will be permanent?
Um, so I think, you know, rapid adoption of telemedicine, with all its flaws, has been one of the things that we have all been focusing on over the last few months. And I feel like it has its own benefits in a way. Uh, and uh, basically just adapting to that new change, and being able to organize that time in such a way that we can address every single problem of our patients, um, has been something new and something that we have adapted to. And I feel like as a student, a lot of online learning has been the case for the most part. I have been working also with medical students in our hospital right now, and we have just started coming back to doing clinical rotations. And the rest of all their learning is all online. So I think that a big part of the online learning is going to become a become almost something that they will have to get used to in the long term. Um, I think that will be a change that I would consider almost close to being permanent. And adapting to telemedicine and being able to address all the chronic issues of our patients' problems through telemedicine is going to be a challenge. And advocacy, for more telemedicine coverage, will be another process that will probably become, uh, a policy in future. So I think that will be another change.
With your specific population, has telemedicine kind of created some of its own challenges? With lower income populations, have they had issues with being able to connect via telemedicine that you've seen?
Yes, that has certainly been a challenge because a majority of our population is from a low socioeconomic background, and they do not have access to internet or access to a smartphone or access to a laptop. So they are unable to sign up for my chart and do their virtual visits with us. So that has been a challenge. So we have been doing a lot of telephone visits, which is not as good as doing a virtual, video visit because it's always nicer to see your patient, and by looking at them you get a lot of information on whether they're sick or not sick, and they're able to show you something, they're able to show you their feet and swelling on their feet, which we're not able to assess on a telephone visit. Um, but slowly our program is trying to also implement a few new changes, like trying to do some home visits for some of our patients that cannot make it to the clinic and who have chronic problems. We are trying to implement some of those things. yeah, I agree though that telemedicine has been a challenge.
What skills do you think family doctors need to fight the pandemic? And how do you think residency and medical programs are adapting to help their students and residents meet these demands?
Um, yeah, that's a very good question. I was thinking about that for a while, but so I would say, as a family doc, we need to uh, first, basically, we need to follow credible source of information such as the CDC and some of our local medical societies, and encourage some of our loved ones and the people that we interact with to stay indoors and wear a mask. I think those are some of the basic things we could do as a family doc. Just expressing our voice and expressing the knowledge that we have to our immediate people and the people surrounding us. Um, Secondly, I think as a family doc, I think this is a time when we need to have a lot of compassion and a lot of kindness towards our patients. Patients have been very stressed. They have been, um, very frustrated. They have been worried, and a lot of patients have been very grateful as well. So I think we need to show a lot of grace and a lot of empathy and a lot of compassion during this time. I know it takes a toll on us as family docs, but we're just being overworked at this point. But I think those are some of the skills we really need to focus on even more during this time. And some of the strengths of just being a family doc, I realize those values a lot more now because I'm able to bring a mom and her little baby and her mom and everybody to a visit and just make it one visit at a time. And I'm really glad that my family medicine skills is giving me that scope of practice where I can manage and treat both people from all generations. So I think we would have to kind of adapt ourselves to doing more of this type of care where we kind of address a lot of issues in a single visit and try to meet with the whole family during every visit so we can keep the whole family's health intact.
What have you learned through this pandemic?
Um, so I have learned to adapt to changes in the first place, and I've learned to read a lot of credible resources. I feel like my reading and my desire to seek information and seek legitimate information has gone up significantly during this pandemic. I constantly, as soon as I wake up in the morning, the first thing I go about is like looking at credible resources to see what are the most recent updates. And our residency program has also done a very good job of giving us regular updates on managing COVID. Um, and then, so I feel like my desire for just more accurate information has gone up. Um, and I think overall, as a person, being more resilient and being more patient has become another skill that I'm constantly trying to drive myself through. So, because I feel like that's a huge part of being a physician in this pandemic. Um, and also rapidly adapting to new changes such as telemedicine. It is a completely new thing for all of us, and but I believe that this has allowed me as a physician to evaluate patient safety and allow them to also physically distance from the hospital and from me. And it has also helped me recognize the chronic illnesses that my patients would have otherwise neglected, um, and also prevents. It helps me feel good that I prevented them from having an ER visit or having exposed them to the coronavirus because just having to come out of their uh, homes to see me.
If you could start this year over again and do things differently regarding COVID-19 care, what would you change?
Yeah, it's always nice to look back and look at what are the flaws. But I think overall we knew this was coming, but we were not prepared for it. So I think more preparedness, clearly assigning roles to everybody within the hospital, clearly assigning respiratory clinics, identifying the people that are sick from the people that are not sick. Um, and also, I also think adequately stocking on PPIs and everything was something we were not doing, and we were not prepared for this massive, pandemic that has just swept the nation. So, I think also, from a government standpoint, I feel like overall there was a little bit of a sluggish response initially, but they were also denuded by a variety of opinions and you know, but the whole thing just snowballed on us, and um, overall, I felt like it was kind of a bloated, inefficient healthcare system, and we were not prepared for the ensuing wave of sickness that just fell upon us. And also kind of certain policies um, have have somewhat left some of our um, specific, like our Black American population and some of our Latino population be disproportionately affected and more vulnerable to COVID-19. And that is because of several years of just they being not having enough access to healthcare has put them at higher risk for and more vulnerable to COVID-19. Also, kind of social media platforms have sometimes spread a lot of misinformation about this, and I feel like that could have been changed as well. So overall, I would say, having um, more preparedness, having more access to healthcare, and clearly set guidelines, and also improving information. How we provide information to the public in the form of like more um, like legitimate resources and not just random resources. So I think those things could have been changed, and that could have made it a lot better.
During the pandemic, what do you feel you have done right and why?
Yes. As a person and as a residency, I want to speak for I think whatever I voice is kind of part of my residency as well. So I'd like to voice that. I would say as a residency, our program has been very good at addressing the wellness of every single physician at this point. So they have been constantly checking with us and making sure we're all doing okay. They have been ensuring that we're all not burned out. Um, I feel like those things have all gone really well for us. We have tried to make changes as soon as we can. So the whole clinic system, right from our chief medical officer to all the residents and all the nurses and the MAs and everybody have all come together for meetings every month and try to brainstorm ideas on what is working well and what is not working well. And because of that, we have been able to establish good a separation of respiratory clinics versus regular clinics. So we are trying to see some of our really sick patients at the respiratory clinic and not bring them over to the regular clinic where we see our regular patients. So I think that part has worked really well for our clinic, and we constantly have a provider at the respiratory clinic every day, and then um, we also are able to take care of our regular patients. So I think that part has gone really well for us as a clinic. And so, as far as wellness and taking care of our patients, we are trying to do our best. And even our hospital has been really good at getting all of us fit tested for our N95 masks. So, as far as PPE goes, they have been really good at collecting enough PPE, and so in the hospital too, I'm able to take care of COVID-19 patients without any, concerns about PPE and stuff, because I think I have enough that I'm able to recycle those and use them. So I think we have done a pretty good job as a hospital and as a residency um, in just managing whatever is thrown at us at this point. I know it's probably going to get worse in the next few months, and but we are constantly having meetings and trying to be more prepared for that as well.
What do you feel went wrong and why?
Um, as a few things again, like what I felt went wrong was again a lot of misinformation. Initially, we had a few, we were treating patients with a certain medication that we thought would be effective, but it turns out that was not effective. So there has been constantly changing protocols, and I feel like at the end of the day, our patients were probably affected by that. And then a lot of hospitals, especially in Idaho, have been um, especially in the rural Idaho, have been suddenly have had this big influx of COVID cases, and they have been transferring patients all over to some of the bigger towns, like where I live in Boise and Nampa. Um, so one of the main things I feel that has caused a lot of spread is just the masks and people not understanding the social distancing very well. And again, there has been, I know wearing a mask is like one of the main things, and I feel like people have constantly missed that piece of it. And I think, just a second. Yeah.
Sure.
I think, yeah, constantly, exposing themselves. A lot of people continue to believe that there are a lot of conspiracy theories around it. And so I think overall, the whole message that this is a very aggressive virus, and it has been affecting people of all ages and all, on all age groups, and it affects people very differently. We have had very young people die of COVID as well with no other comorbid conditions, and we have had very old people die as well. So it does not spare any age. But there is a lack of understanding of that in the community, and people continue to believe that this only affects people with underlying comorbid conditions. And a lot of my patients have got the COVID-19 from attending a lot of mass gatherings, attending family gatherings, and with a large group of people. And we have had a lot of cluster outbreaks as well. I did a study on 3 different cluster outbreaks in food packaging industries in Idaho, and turns out that there has been exposure from just not wearing a mask, and also a lot of people being part of family gatherings. Um, so I think that part has not gone well. People have just failed to understand that wearing a mask is very important at this point.
Who are the people you have worked with most closely during this pandemic? Who has impressed you during this time and why? And were these established professional relationships or new relationships?
Yes. So I have been working with a lot of my nurses in the respiratory clinic, a lot of medical assistants, a lot of front office people, receptionists, and a lot of people in the hospital that do housekeeping, and a lot of other physicians who have been pulled from their own specialties to do some COVID care. We have had anesthesiologists that have been asked to come and intubate our COVID patients, nurse anesthetists who have been intubating our patients. We have had nurses pulled out from other specialties to come and work in the ICU and our telemetry floors exclusively to take up COVID-19 patients. So I think I have a very special, I have extra respect for people, especially my nurses and my housekeeping staff in our hospital, who go in and out and help clean the room, and and of our COVID patients. As a physician, I feel like we all have the education and we understand infection control, and because we are taught all these in our school. But with somebody that does housekeeping, they are constantly exposing themselves, but they do it without cringing about it, or without complaining about it at all. So I do have a lot of respect for them, and they always continue to smile at me. They say hi to all of us in the hospital when they see us in the hallways. So I think I have immense respect for my housekeeping staff, and also for my nurses and medical assistants in the respiratory clinics, who go out and they talk to my COVID, like patients with symptoms of COVID, and they come back and chat with me and tell me what's going on and everything. So I feel like they are the real frontline heroes.
What is your sense of where family medicine is going in the future?
Um, I think family medicine, I could talk to this about in 2 different buckets. So one is, I would say, we are trying to move towards more quality-based care, where you know, our remuneration or our pay is going to be based on the quality of care that we provide. And I'm a big advocate for that. I think we as physicians should really focus on that. We really get sometimes we get lost in just documentation and insurance challenges and other things. And I think quality-based care will be definitely the way to go. And I'm in full support of that. And I know the AAFP has been working towards that as well. Um, and another thing, as far as care goes, I feel like as a family medicine doc, we um, are able to provide full spectrum family medicine, and we have been trained to do that. And just with all the primary care shortage in the country right now, I think there is going to be more emphasis on primary care because we have been in the cities. There's been a lot of dependency on specialists, but actually, a primary care provider can manage a lot of things, and that is part of our training. So, being being a full spectrum family medicine or full spectrum primary care provider is also going to be the way to go. Just given pandemic and other reasons, I feel like patients will be very comfortable to bring their whole family to your clinic, and so you can take care of the elderly and the middle aged and the the younger ones and the children and the newborns and the infants. And I feel like we should start focusing more on full spectrum care, where we can provide care to the entire family across generations, and also be able to provide like emergency medicine care and OB and things like that. So I think more comprehensive care will be also something I see in the future.
Any views on important issues in the specialty related to COVID-19 that we have not addressed here that you would like to share with us?
Yes. So a few things, as far as COVID-19 goes, we have had times. I think there was one wave when we had a big wave in the months of like May, June, when we stopped a lot of elective procedures. And then after a few months, we restarted those. But now again, we are back. We have stopped all elective procedures in the hospital because we have the second wave of COVID now, and it has hit pretty hard. So I think I feel like a lot of patients we are contributing more to morbidity in patients by not doing elective procedures. But I totally understand we do not have enough room or staff to accommodate elective procedures at this point. But a lot of patients, who need like a resection of a tumor are not able to get it done right now. So they continue to have live in pain or live with a lot of symptoms. A lot of patients have a lot of fear to go to a hospital. I had a family member um, in India that died recently because she did not want to go to a hospital. She had fear of going to a hospital to address some vomiting issues that she had. She ended up having a heart attack, but um, at home. But again, there is a lot of fear of going to a hospital. And I think people are tend to ignore their symptoms because there is a lot of fear around the COVID. Um, I think that has been a huge challenge. Um, COVID also causes a lot of other multiple problems that I've constantly been seeing in our hospital and with all our patients. One thing is it increases the coagulability in your blood, so people tend to clot a lot more inside them, and that has certain long-term consequences. Like people can get a lot of heart attacks and strokes and problems related to that. And although the Neurology Society reports that the number of strokes have gone down, that is simply because patients are just not showing up in the hospitals when they have these symptoms. So I think that has been a huge challenge right now. I had a patient the other day as well with a severe health condition that required a surgery immediately, but she called and she postponed her surgery by a few months. But she kind of needed it immediately. Otherwise, that's probably going to be very, fatal for her. But she was very scared of the COVID and she did not want to go to the hospital. So um, that is going to be a big challenge for us. And I think it's going to cause people more morbidity and mortality from other causes as well.
Are there any other last thoughts you would like to add?
Yes, I actually wrote some things down that I want to share for my last thought.
Sure.
Um, and I think, I'm going to say, um, just a second. So I would say, those of us that are caring for both COVID patients, either directly or indirectly, need to start considering how we can minimize the catastrophic impact on our ability to provide primary and chronic care to our patients. There are several ways we need to start thinking about how we could do this better. We should encourage more patients and all our people around us to wear masks and socially distance themselves as much as possible. If businesses need to stay open, then everybody needs to wear a mask. Um, and be able to socially distance and wash their hands. I think those are like some of the basic things that we can all do as a society to minimize the catastrophic consequences of this pandemic. We also need to plan a lot more and find solutions that can adequately mitigate harm for our patients and also for us. And if we, as we continue to reopen the society and open up schools, we should be in a good position to provide for better access for PPE to not just people in the hospital or staff in the hospital, but also people outside who are working outside of the hospital to deal with workers or people that are coming in sick. So they should have better screening measures at every single facility or at every single business or anything. They should have a better like screening procedure for people that come in with symptoms. Physicians should have better access to PPEs, testing kits, telemedicine reimbursement, and healthcare coverage for all. I think COVID is on track to catalyze a total overhaul of how we provide and pay for healthcare. And if our country comes together to embrace change, we may be able to improve access in the long term. But whatever happens, we cannot wait for too long, and we must continue to fight for our patients' needs, both in sickness and in health. And I think advocating for our patients in the right sense should also be one of our biggest goals in this. That's all I have to say. Mhm.
Well, thank you so much. If you have nothing else to add, this will conclude our interview, and I'd like to thank you for taking the time to do this interview.
Thank you. I appreciate it.
No problem.